Hello.
Hello.
Hi.
Hi, doctor. I'm Anusha.
Yes, the child just sleeping beside me is Abdullahi Usman.
Okay.
Yeah, is
Abdullah
Ab-
Yusman.
Usman.
Okay.
Yes, he's a 4-year-old
Okay.
preschool child. 4-year-old preschool child,
Uh-huh.
born to two parents. Both of them uh, earn less than $100 per month.
Okay. Um, well, can you tell the patient that I say Inawune Sunana Anusha and
Yes, Abdullahi Haja. That is Afada Mugo Sunanta Anisha. So can you see her? She's waving at you. Anisha, can you hear me?
yes, I can hear you.
Yes, the mother is waving at you. I have sent you greetings.
Oh, okay.
Yes, that's good. So now the patient have a medical history of passage of bloody stool and
Okay.
abdominal pain.
Okay.
Bloody stool, abdominal pain for 1 week,
Okay. Um,
and there is associated history of weakness,
mhm.
loss of appetite, and fever.
Okay. Um, could you do you know what the patient's fever is like?
Yes, the fever is intermittent. It's intermittent one.
Intermittent. Okay. Do you
It
know
comes and goes.
comes and goes? Okay. Do you know if the
Yes.
patient has could you ask the patient if they have like a sore throat, runny nose, any chest pain?
No, there is no running nose, chest pain, or cough.
Okay. Okay. Does the patient have any abdominal pain?
Yes, there is no abdominal pain, but there is abdominal distension.
Okay. Is there any swelling of the legs?
No, there isn't.
No. Um,
Yes.
doctor, would you mind if I compared your hand to the patient's hand? And is it okay? Can you ask the mother if it's okay if I take a look and ask a few more questions?
Yes, she said that we can go ahead.
Okay, thank you. Do you mind holding your hand next to the patient's hand?
Yes, the patient though is sleeping. I don't want to wake him up. But can you
Okay.
see my hands?
Yes, I can. Um,
Yes, yes. There is. This is the foot. Can you see
okay.
them?
Yes, I can see them.
Yeah. So now
Okay.
can you compare the foot with my hands?
Yeah. So I think
Yes.
they look okay to me, but um,
Yes.
okay. So I have a few suspicions of what he may have. Um,
Yes.
do you have the results of the rapid diagnostic test?
Yes. The rapid diagnostic test is reactive, positive.
It's positive. Okay, and I think
Yeah.
just to be safe, I'm not sure if he has this, but do you know what his hemoglobin level is from the full blood count?
Yes. Yes, the full blood count shows that the hemoglobin is between around the 7.8%, 7.8
7.8.
milligram.
Okay. Okay. Is it okay if you share with me a little bit of the patient's living conditions?
Yes, they have a very the living condition is they're living in an overcrowded environment.
Okay. Okay. So I would say I would recommend that the patient has ACT for since the rapid diagnostic test came back positive and is on
Positive.
and is given iron supplements and
Yes,
possibly if the hemoglobin goes down any further, a blood transfusion may be
yes,
necessary. And
yes. He has
I
been
think,
transfused this morning.
oh, okay. Um,
Yes, he has been transfused.
okay, so I think in the future, to prevent illnesses like this again, I think try to like wear long sleeve clothing and use mosquito netting and insect repellent and stay on iron supplements so the
Yeah,
hemoglobin
that is
levels would
good.
be normal.
That is good. That is great. I'm very impressed with this line of management. But do you remember the history that there is bloody stool?
Oh, yes. Um,
Yeah.
do you
So what
have
can you do about that?
do you have the results for the blood culture test?
Yes, yes. We have the blood culture. It shows that there is salmonella.
Salmonella. Okay, so
Yeah.
I would recommend antibiotics for that.
Antibiotics. Yeah.
Yeah.
Which antibiotics?
Um, uh, ampicillin, amoxicillin, or centrofloxacin.
Yes, it's good. Amoxicillin is very effective here, down here.
Okay.
Yes, and then chlorophyll also can be used.
Okay.
Yes. So which treatment will you give to the child if it's a complicated or severe malaria?
If it's a complicated case of malaria, possibly. So besides the ACT, maybe oh, um,
Is it an IV?
yeah, like an IV of
Yeah.
antibiotics.
And antibiotics? No. Is there any anti-malarial IV that you know?
No.
Have you ever heard of artesunate?
Oh, yes, I have.
Yeah. Have you ever heard of quinine?
Yeah, I have.
Yes. So those are parenteral antibiotics, IVs.
Okay.
So in severe case of malaria, we use that.
Okay.
Yeah. So now, what other things will you ask the patient, or what other things would you like to tell the patient in terms of prevention?
Well, I would say in terms of prevention, you said,
Yes.
so drink more water, and
Yeah.
just make sure to wash hands,
Yes.
especially.
Yeah. Yeah. That is very good. And what other thing? Environmental factor. What other environmental factor would you like to tell the patient to make some changes about?
So I would say, don't go out as much at night, like try to stay away and try to try to stay in like a clean environment.
Yeah. So, that is very good. So now, apart from that, what other thing do you think of? He has malaria, and what other thing would you like to tell the patient in terms of prevention of malaria?
So I would say, like use mosquito netting, especially while sleeping. Um,
Yes,
Long sleeves, insect
yes,
repellent, and
yeah,
trying to avoid like times of day where there's a lot of mosquitoes outside.
yes. So that is very good. I'm very impressed. I'm very impressed, Anisha.
Okay, thank you.
I have hope in you that if I got sick with malaria, I will be very confident that they will treat me well.
Thank you. Um, well, thank you, doctor. Could you tell the patient that I said thank you and I hope that he feels better?
Yes, Tachitana Gaisheku. Can you see her now?
Yes, I
Yes,
can
she's
see her
waving at
here.
you. Yes, she said that they are very grateful,
Okay, yeah.
and they also thank you.
Oh, well, you're very welcome. I'm happy to be able to help.
Thank you very much.